So my name is Dr. Mohammad Bustani, recently joined JU. I've done my undergrad in JU back in 2013. بعدين I finished my Masters of Clinical Dentistry in King's College London and did my MPros in Royal College of Surgeons, recently passed the Jordanian board تبع البروز as well, but still I can't say that because it's not official yet. I'll be teaching you 2 lectures this semester, impression materials 1 and 2. I would prefer لو إنه خلصناهم in one setting, but it's fine. We can do a quick recap next week. I know all materials a little bit dense, so it could be a little bit overwhelming لإلكم, since you might not be exposed to impression materials أو حتى شو يعني impression in general. I'll try to make it as simple as possible. So please stop me whenever you want, ask some questions, بس خليها some sort of order. إذا كان حدا عم بحكي wait until he finished or until I answer his or her question, بعدين ask your question, okay? It's so weird, I'm talking to a laptop, so please make it as interactive as possible to feel less weird. This is the quick outline of our lecture today. We'll start by quick definitions, then the ideal characteristic of an impression material, then we will go through each impression material until we reach the all the materials, until we cover all the materials. This is the main reference for us, my preferred reference. It's from Phillips Dental Materials at chapter 8, okay? It goes into a bit of details around impression components and setting reactions. So for you as a second year student, you might need to skip these, but if you're interested, read the whole chapter. Usually our definitions are taken from the glossary of prosthodontic terms. The latest edition is the 9th edition, which was published in 2017, I guess. So whenever you want to say any definition in dentistry, please go back to this reference and get your proper definition from there. So to start with, what is an impression? Impression is a negative likeness or a copy and reverse of the object that you are taking an impression of. In dentistry, it's the imprint of the teeth, the adjacent mucosa, gingival margins, the palate, and sometimes we take a part of the soft palate or the tongue in case of the maxillofacial prosthesis also. Okay, so in short, it's an imprint of the teeth and the adjacent structure in dentistry. In order to take an impression, we need an impression tray to hold, we need an impression material to take the impression and impression tray to hold the impression material. So impression material is defined as any substance or combination of substances used to take an impression or an electrical production of an object. The tray is the device that you use to carry this material. Okay. To take an impression of an object, and then let's say you're making a crown, you need to prep the tooth and then transfer this shape of the preparation into your technician, where he will produce a casting or produce a Emax crown or whatever material you would like to make the crown of. The main or the most important characteristic for the impression to be accurate. So you transfer the shape of the preparation accurately to your lab, so the crown will fit precisely. All right. So the main ideal or the main component in the ideal characteristic, I would say it should be an accurate. Okay. The impression material should be, to start with, a little bit flowy. So it's go and flow and capture all the details around the teeth, the grooves, your finish line when you prepare your teeth, and then it should, when it's set, it should become an elastic so it can removed out of and undercut easily. Okay, and we go into details about elastic and rigid impression materials in a bit. So we said it should be accurate, it should be viscous enough to be contained within the tray, so it shouldn't be too flowy and leaking out of the tray. It should be a little bit viscous or it can't hold itself. Is someone asking anything? في حد يسأل؟ Okay. في حدا يعمل unmute صور السلايد وكمل. Okay. Also, the material should be easy to handle. It shouldn't be messy. It shouldn't take a long time to set. So it should be fast setting. Also, it should adhere to the tray. So when we take out the material out of the mouth, we need the whole material in the tray, not sticking to the teeth, and should be adherent to the tray and don't have any separation, so any rebound in the material won't affect the accuracy of the impression. Okay. As we have said, it should be elastic with adequate tear strength after setting. So when we take it out from the mouth, it won't tear. For example, if we have some teeth that are periodontally involved, we will have some recession and we'll have some spaces in between the teeth, which will act as an undercut. So if the material went in and it was a rigid material, when you try to take it out, you won't be able to take it out. You will either, you might even extract the teeth, or the material will tear. So it should be elastic, but with adequate tear strength in order not to tear and get out of the undercuts. Then it should be dimensionally stable, meaning when it sets, the material should hold the same dimensions. For example, when we talk about alginate later on, the alginate material is hydrophilic material, so it loves water. It will imbibe water, so if you immerse it in water, it will take out of the water into the material and swell a little bit. So the cast, when you pour it, it will be smaller than it should be because the impression is swollen. On the other hand, if you kept it exposed to air for a long time, the water will evaporate from within the material, and the material itself, or the impression material, will shrink a bit. So your cast will be larger than it should be. When the lab make your crown, it will fit perfectly on the cast. When you try to put it inside the mouth, it won't fit because the cast is bigger than the preparation in the mouth. Okay. Then most of our material in dentistry should be biocompatible, bioinert. Ideally, it should be cheap or low cost, let's say, with acceptable taste and odor. The other thing is hydrophilicity. Hydrophilicity or wettability could be an advantage when we take an impression because of the presence of the saliva in the mouth, and some sort of a disadvantage when you pour your cast. So when you're using a hydrophilic material, when you are using a hydrophobic material, you need to use a surfactant when you pour your cast. We'll talk a bit more probably next week when we are talking about silicones regarding pouring impressions of a hydrophobic material. Anyone got any question about the ideal impression materials? I know I've been talking for about 2 to 3 minutes. It might be all nonsense to you. So, any questions?
I want to ask a question.
Mm-hmm.
We said that this material is hydrophilic.
Mm-hmm.
So if we want to put after taking out the impression, we're going to pour in another material to take the shape of my impression.
Yep.
Yeah. So what you mentioned about the surfactant, what is that? We should spray it before pouring in.
Exactly. Basically, it's material that reduces the surface tension. So the water that is included in the gypsum, material that we're going to use to
won't be absorbed by the impression material.
Sort of, yeah.
Yes. Thank you.
No problem. Anyone else? All right. This diagram is most probably the most important diagram in the whole lecture. If you memorize it, and I urge you to memorize it for next year and the following years, you'll be able to remember all of dental materials easily. Anyone got any questions? Can you please make sure you are all on unmute your mics? Mute your mics. So, impression materials, we have can be classified into different ways. One of the ways to be classified is into elastic materials, which are the materials that can rebound out of an undercut without any distortion in the shape, and inelastic or rigid materials which can't be used with undercuts. Okay, examples for the inelastic materials are impression compound, zinc oxide eugenol, impression plaster, and impression waxes. Most of the time, these are the materials that we are going to use with edentulous patients, those who need complete dentures. Around teeth, we have lots of undercuts, so most probably we'll go into using an elastic material. The elastic materials can be either a synthetic elastic material or hydrocolloids. The hydrocolloids can be reversible, such as agar-agar, or irreversible materials, which is the alginate. Then the synthetic elastomers are polysulfide, polyether, C-silicon, and A-silicon. And I've highlighted the main material that we'll be using in dentistry now. A-silicon, polyether. Polyether is a little bit rigid, so sometimes we don't like to use it around teeth much, mainly used with implants. Irreversible alginates is probably the most commonly used impression material in the world. Used to take primary impression, diagnostic cast, or even secondary impression in completely edentulous patients when we have some undercuts. The impression compound you'll be using next year in the lab and the following years on clinic to take a primary impression for your completely edentulous patients, and then the zinc oxide eugenol for your secondary impression. Okay, impression plaster is mainly used as a special impression material for special impression techniques, but we don't use it much because we have silicons now. Impression waxes is used to modify like a small bubbles or small defects in your impression. This is the first classification into elastic and inelastic. The other classification could be a reversible or irreversible reaction, or let's say physical reaction or a chemical reaction. Impression compound, impression waxes, and reversible hydrocolloids can go back from the one state into the other, the flowy state into the more rigid state when we take an impression. The others are all set via physical reaction. Okay, the most commonly used classification is elastic and inelastic. We will start with inelastic materials, the rigid materials. As we say, they can't be used around undercuts because when you take the impression out of the patient's mouth, it either will fracture or it will have some sort of permanent deformation when it's going out of the undercut. Plus, it might traumatize the patient as it's passing through or against the bulge of the tissues. I already said that. Impression plaster, as I said before, it's mainly used for flabby tissues as a special impression technique, but we don't use it much nowadays. Impression compound. This is a photo of a primary impression for a completely edentulous patient. Okay. As you can see, it has a unique color, let's say a brownish color. So you should be able to tell when it's compound or other materials. Compound is made of natural plus synthetic resins and waxes. It can be classified into two types. One has a low fusing temperature, which is used as an impression material. The other one has a higher fusing temperature, which is used to construct a tray. We don't use it as much as nowadays. We mainly use the impression compound for primary impression for edentulous patients. So it's mainly type 1. Type 1 as well comes in different shapes. A cake like that, which is softened and then molded into the tray and used to take a primary impression. The other one is the sticks. These sticks has different fusing temperature, but still all of them are within the low fusing temperature group. They are used to make border molding for the secondary impression. As we have said, the impression compound is a reversible material, so it has no chemical reaction. It's mainly a physical reaction through heating. So the characteristic is called thermoplastic material. So when it's soft, when it's heated, it's soft. When it's cooled down, it will be hard again. The temperature range that is ideal for softening a compound, the cake compound, is between 55 to 60. Okay. Sorry, this is a dense slide, but I just want to highlight these 3 points. You'll be asked a lot about these 3 the following year, most probably. The impression compound, when you take it out of the patient mouth, it will have lots of internal stresses because it has a high coefficient of thermal expansion, in addition to a poor thermal conductivity and a large drop from the temperature inside the mouth into the room temperature. So all of these stresses within the material will cause the material to change its shape a little bit. So it has to be done, so the pouring has to be done as soon as possible as you take it out of the patient mouth. It's not a dimensionally stable material. Plus it might be heated a little bit during transfer from the clinic into the lab, especially in hot days. So it might melt a little bit and change the shape of the impression. Now we're going into the second material, which is zinc oxide eugenol. This material is used for a secondary impression for a completely edentulous patient. It comes in 2 tubes. One of them contains zinc oxide, the other one contains the eugenol. The eugenol is the catalyst and the zinc oxide is the base. They react physically through an acid-base reaction, producing a salt which is a rigid material on setting. There might be some other uses for zinc oxide eugenol, but with different consistency, different ratios between the zinc oxide and the eugenol. It might be used as a dressing for after surgeries. It might be used as root canal sealer, or even a filling material, a root canal filling material. It might be used, or it's used as a temporary cement for the crowns when we're waiting for the finals to be delivered. I think these are the main uses. They are dimensionally very stable. Initially, it has a very low viscosity, so they flow and record all of the details very accurately. And then when it sets, it's rigid, so it shouldn't be used when the patient has undercuts. In this case, we will go into using eugenol, alginate for secondary impression for a completely edentulous patient, or silicones. Some patients might be allergic to eugenol, although it's not very common. I think it's around 0.1% of the whole population. The patient will just experience some numbness, just a bit of numbness in the palates mainly. And the lower can be managed a little bit better because they have saliva and so. The third material is impression plaster. Impression plaster is the same material that is used to make the cast itself, which is made out of gypsum, but the ratio between the water and the powder is a little bit different. We have a high water to powder ratio, while when we pour the cast, it's almost 1:1. Here it's 0.6. The characteristic that make the impression plaster the material of choice when we have some flabby tissues is called mucostatic. Mucostatic meaning that we don't have, the material itself doesn't apply any pressure on the tissues while you are recording them. So you are recording the tissues at their static position or at their most relaxed position. Okay. The other disadvantage, the other characteristic that's considered a disadvantage is they are very brittle, so it will fracture as soon as you take it out of, if there was any undercut or if it was sort of unsupported. Okay.
دكتور لو سمحت شو بنقصد undercuts يعني exactly شو
undercuts meaning انتوا شايفين ايدي ولا لا؟
شايفين.
اوكي. السن usually ما بيكون مستقيم هيك، اوكي، بيكون فيه بلج. هون بيكون undercut in relation لهاي area. شايف السبيس between، او خليني احط ايدي هيك، هاي الاريا بعتبرها undercut in relation للفيرتيكال او لشيء perpendicular للارض. اوكي، السبيس بيكون undercut زي طرف الطاولة من تحت ايدك بيكون undercut. إذا تحط إيدك تحت الطاولة هذا undercut in relation للطاولة من الجنب.
اوكي
يس. لا first one sorry. هي اشوف لك شايف التشيوز هون تلاقي في زي بلج طالع وراجع فايت، while in this area ما في undercut ابدا. تخيلتها؟ سوري لازم ابحث صورة ثانية. alright. So حكينا mainly used for flabby tissues. The reason why I don't use it anymore because we have silicons. The light body silicone is also mucostatic and has a higher tear strength and can perform in an elastic manner, so it won't fracture or even it won't tear. A special consideration when we take this impression, it's called bottling technique. Usually when we take an impression, we take it a one shot. Once we place the tray with the material inside the mouth, we don't move it anymore, okay, because the air bubbles will be trapped and you'll end up with defects and drags on your impression. Except with plaster. Plaster has a very flowy characteristics or very flowy consistency. So even when you take the impression, you can move it a little bit back and forth and right and left until the material flow and cover all of the surfaces, and then hold it in place until the material is fully set. Okay, because the gypsum is the main material that we use to produce our cast, we need to put a separating medium when we pour our impression plaster, so it won't stick to the gypsum that is used for the cast. So usually we just smear a layer of Vaseline or petroleum gel on your impression before pouring it. Most probably when you won't use this impression material anymore. This slide I mainly put it down just to show you how impression materials components are made. The impression plaster are made of gypsum, which is beta calcium sulfate hemihydrates, then mixed with water until rehydrate and form a calcium dihydrate. But the setting reaction caused some expansion. In order to reduce the expansion, they add potassium sulfate as an anti-expansion agent. At the same time, potassium sulfate will accelerate the setting, and you won't have enough time to place the impression material inside the mouth and record all of the surfaces. So they will add borax to reduce or retard the reaction or to control the setting time. Okay, so the addition of one material will induce or will result in addition of multiple materials in order to come out with the ideal characteristic of the impression material. So that's the main difference between the impression plaster that is used, the plaster that is used for the impression, and the plaster that is used to pour your impression and form the casts. The fourth rigid material is the impression waxes, and as we have said, it's mainly used to correct small defects or usually taken bite registration material. It's not used as a impression, overall impression usually. Okay. Again, it's a thermoplastic material, so when it's heated, it's soft and flowy, and then sets at room temperature. Any questions so far? Okay. Can anyone tell me the main use of impression compound? Anyone?
For taking primary impressions.
For?
Denture?
For
Make denture?
Yes, edentulous patients, not the denture itself, for edentulous patients. Okay. Why can't we use it for a primary impression for dentate patients, patients who got teeth? No. ليش ما بنستخدمها للناس اللي عندهم اسنان؟ ليش بنستخدم الجينيت؟ ما بنستخدم كومباوند لبرايمري امبريشن لناس عندهم اسنان؟
دكتور ممكن عشان when you put it out of the patient's mouth it can pull the teeth with it.
اوكي. ايش الكاركترستيك اسمها؟
Inelastic.
inelastic او rigid. It can't be used in undercuts. الاسنان كلها لها shape، لها bulges، كلهم هدول undercuts. Alright. Just shall we start with elastics? What time is it? Oh, 7 here. Elastics got two main families: hydrocolloids or synthetics, or synthetic elastics. Hydrocolloids are usually made of. To start with, the colloid means a suspension of material or a material that's suspended and dispersed uniformly in another material. You can read out the definition from the GPT. When it's called hydro, that means that one of these two materials is water. Usually the water is the dispersion phase, and the dispersed material is the alginate or agar in case of the agar. Agar is the physical reaction one, so it's the reversible one, which sets by a physical setting through heating and cooling, while alginate got a chemical reaction, so it sets irreversibly and can't go back into the solid state. Gel means it's still viscous and setting. Sol means it's flowy and you can use it to record the impression. Agar is made of agar, which is extracted from seaweed. The components of the material it's made of 85% of water, along with just about 12.5 colloid or agar, and then potassium sulfate as a accelerator for the reaction, and the borax as a retarder of the reaction. Okay, same as the one that's added to the impression plaster. You can see in the photo that agar is supplied in two tubes, similar to a toothpaste tube. They are mixed together and then tempered in. First of all, they are heated in the first bath on your right to about 100 degrees, and then stored in the second bath for about 70 degrees, and then they are tempered down to a degree, something between 30 to 50 degrees, to be ready to introduce to patient's mouth. Okay. Then we have this tray. It's a special tray with a water current running from one side all the way into the other to start the setting reaction of the material inside the patient's mouth. Then when we take it out, the material will be in its gel state. So this material needs some special equipment, and it's a bit expensive, so we don't use it anymore. Plus the fact that it's called reversible, means that it can be used or reused over and over again. But in case of a patient, we have the cross-infection difficulty. We can't make sure that the material is sterile enough after the pouring the first impression and then melting the impression back again, the impression material back again. We can't be sure that the impression is properly disinfected. So we have a cross-infection control problem. That's why it's mainly used nowadays in labs to duplicate casts. Okay. Plus, it's a bit expensive. The fact that it's made of 85% of water means that it's hydrophilic material. All right. It got a very accurate. It can produce very accurate details, but at the same time, we have the problem that it tears very easily. Okay, so that's the main problem with the hydrocolloid agar-agar. The other one, which is the most commonly used to take primary impression for dentate patients, and even it was used to take a secondary impression for crown preps, and might be used as a secondary impression for completely edentulous patients with undercuts, is alginate. Alginate is supplied in a bag as a powder and then mixed with water. The water should be mixed according to the manufacturer instruction and using their own measures, because sometimes the measure of one manufacturer is slightly different than the other. One of them contain 38 grams, the other one got 42 or so. So you need to use their own measure. In this photo, we can see an example of an alginate material that is called chromatic material, meaning that its color changes upon setting. When you mix it, it will be purple or red in this photo, and then when it sets, it will be yellow. Also, you can see that it says here it's fast setting material. Usually the setting time of alginate is about 3.5 minutes inside the patient mouth. The fast setting, that's the normal setting. The fast setting material will be about 2 minutes in the patient mouth. This is an advantage, especially if the patient has a exaggerated gag reflex. You don't want the material in contact with his palate for a long time. So the fast setting material is usually an advantage. From this slide, I want you to focus mainly on the setting reaction that you can see here. The reaction is between not calcium, sorry. Okay, not sodium. I forgot the name.
Potassium?
Sorry?
Potassium?
Potassium. Is it K? Potassium? Potassium. Okay, maybe. Yes, potassium for alginate with calcium sulfate. It will produce calcium alginate. The calcium alginate is what's called alginate. It's what gives the material its name, or the main component of the set material. The sodium phosphate is the retarder. Sodium phosphate decreases the amount of the reaction or the speed of the reaction through reacting with calcium sulfate. Okay, so the amount of the retarder, the amount of the sodium phosphate in the bag is what make it fast setting or slow setting material. All right. The other thing that I wanted to highlight is the amount of the filler material. The filler material is any material that we use just to give the material some body, some mass. And alginate is about 65 to 75% of its weight. And because it's a bit dense than the other components, usually it يترسب. It accumulates down in the base of the bag, so you need to mix the bag. Sorry. So you need to shake the bag well before scooping out your powder. Just a tip for later on. We have said that this material is a fast setting or quick setting, and that mainly depends on the amount of the retarder. Other techniques or other methods to control the working time or to increase the setting time or decrease the setting time is through changing the powder to water ratio. Changing the powder to water ratio will result in suboptimal mechanical properties. So usually we need to adhere to the powder water ratio according to our manufacturer. So it's not advisable to change the powder or increase more water to make it more flowy. Instead, you can control the water temperature. If you increase the water temperature, you will decrease the setting time. So in a cold day, when you mix your alginate, it will take a bit longer to set than on a warm day. So keep that in mind, or bring yourself some sort of a kettle and then add a little bit of hot water to the mix, so it won't take too long to set. Speed of spatulation will increase the heat and will increase the temperature of the water and will increase decrease the setting time, while using distilled water versus using tap water will affect the setting time through the precipitation of salts that are contained within the tap water. So it's ideally distilled water need to be used. Alginate and even agar-agar are more accurate in bulk because they have a very low tear strength. So if you give yourself more room of the material, it will be a little bit better than a very thin smear or wash of material. So usually we need to have 3 to 5 millimeter space around our teeth to record a proper impression using alginate. The other characteristic is viscoelastic. Viscoelastic meaning that it can record undercut, but at the same time it will deform a little bit more than the proper elastic material. As we said, the material is hydrophilic because it's mixed with water. It's cheap and produces proper or reasonable surface details, but it has very low tear strength, and we have already mentioned that alginate will either gain water or release water if it wasn't stored properly. The term that is used for gaining water when the alginate is in contact with a humid atmosphere or even immersed in water, it's called imbibition, while losing water when it's exposed to air for a long time, it's called syneresis. All right, remember these two terms. As said, imbibition is the gaining of water, right? Usually we disinfect our impressions after taking them out of the mouth through immersing them in a chemical disinfectant. In alginate, we need to be extra careful when we do this step. Usually it's sprayed with the disinfectant and then wrapped with a damp towel or damp piece of cloth until the disinfectant time is over, usually about 10 minutes. Then we take it out, rinse it again, and store it in a bag in a damp towel or a piece of tissue. Then we transfer it to the lab. If we kept it for long, it will embed the water from the damp tissue into the impression material, and it will swell, or it will lose water if it was stored for too long. So ideally, it should be poured immediately. Okay. One interesting technique is when we use both materials at the same time. The disadvantage of agar-agar that it needs special equipment, which is expensive. It needs the tray with water coolant in order to decrease the temperature of the agar-agar until it sets in the patient mouth. It sets around 25 degrees, so the cold water is running in the tray to make the material set. They came up with a technique where they use both materials, alginate and agar, and the same impression. The alginate will be loaded in the tray, and the agar will be syringed around the tooth that is in question. When you have a crown prep or something, you will syringe it around the tooth, and the alginate will be loaded in the tray. Then you insert it over the agar. The agar and alginate will stick to each other. And because alginate is mixed with relatively cold water, which temperature is usually at room temperature, 23, 24, it will initiate the setting reaction, or it will cool the agar and it will set eventually. Okay, it's just an interesting method you might come across, but most probably we won't be using it as we use silicone nowadays. And we are done with part 1, as I think we are almost halfway. Next time we will be talking about synthetic elastomers, polysulfide, polyether, silicones, A silicon and C silicon. I need more questions now. Shall I turn off the PowerPoint presentation?